Good day everyone and welcome to Women's Health Issues, a channel that is focused mainly on health issues affecting women, causes, symptoms, and possible treatment methods. Okay, we're going to start off this channel by speaking about anorexia nervosa. Alright, so what is anorexia? Anorexia nervosa, often called anorexia, is a type of eating disorder. Eating disorders are mental health problems that cause extreme and dangerous eating behaviors. These extreme eating behaviors cause other serious health problems and sometimes death. Some eating disorders also involve extreme exercise. Women with anorexia severely limit the amount of food they eat to prevent weight gain. People with anorexia usually have an intense fear of gaining weight and may think that they are fat even when they are thin. Women with anorexia may also exercise too much so that they do not gain any weight. Over time, eating so little food leads to serious health problems and sometimes death. So basically, anorexia can lead to death. So what is the difference between anorexia and other eating disorders? Women with eating disorders such as anorexia, bulimia, and binge eating disorder have a mental health condition that affects how they eat and sometimes how they exercise. These eating disorders threaten their health. Unlike women with bulimia and binge eating disorder, girls and women with anorexia do not eat enough to sustain their bodily functions. Women with bulimia and binge eating disorder usually binge eat, that is, eating too much while feeling out of control. It is possible to have more than one eating disorder in your lifetime. Regardless of what type of eating disorder you have, you can get better with treatment. So, you might be wondering, who is at risk for anorexia? Who is at risk for developing anorexia? Well, anorexia is more common among girls and women, but sometimes it will affect men and boys. It is also more common among girls and younger women than older women. So they're basically saying that mostly younger girls are affected by anorexia. On average, girls develop anorexia at age 16 or 17. Teen girls between 13 and 19 and young women in their early 20s are most at risk. Eating disorders are happening more often in older women nowadays. In one recent study, 13% of American women over 50 had signs of an eating disorder. Okay, so what are the signs of anorexia? Some other symptoms of anorexia, apart from looking very thin and not acting herself, may include but not limited to sadness, moodiness, confused or slow thinking, poor memory or judgment, thin, brittle hair and nails, feeling cold all the time because of a drop in internal body temperature, feeling dizzy, faint or weak, which is obviously caused by not consuming enough calories, feeling sluggish or tired, irregular periods or never getting their period, dry, blotchy or yellow skin, growth of fine hair all over the body, this is called lanugo, severe constipation or bloating, weak muscles or swollen joints. Girls or women with anorexia may also have behavior changes such as talking about weight or food all the time, not eating or eating very little, refusing to eat in front of others, not wanting to go out with friends, making herself throw up, taking laxatives or diet pills, and exercising a lot. People with anorexia may also have other health problems, including depression, anxiety, or substance abuse. Okay, so what causes anorexia? What are the possible causes for anorexia? Researchers are not exactly sure what causes anorexia and other eating disorders. Researchers think that eating disorders might happen because of a combination of a person's biology and life events. This combination includes having specific genes, a person's biology, body image, self-esteem, social experiences, family health history, and sometimes other mental health illnesses. So how does anorexia affect a woman's health? When you're anorexic, your body doesn't get the energy that it needs from the food or lack of food, so it slows down and stops working normally. Over time, anorexia can affect your body in the following ways. You develop heart problems, including low blood pressure, a slower heart rate, irregular heartbeat, heart attack, and sudden death from heart problems. You become anemic, which means when your red blood cells do not carry enough oxygen to your body, and other blood problems. Thinning of your bones, otherwise known as osteoporosis or osteopenia. You have kidney failure or kidney stones, a lack of period, which can cause problems getting pregnant. During pregnancy, a higher risk for miscarriage, cesarean delivery, or having a baby with low birth rate. Anorexia is a serious illness that can lead to death. Studies have found that more women and girls die from anorexia than any other eating disorder or serious mental health problems such as depression. So, how is anorexia diagnosed? How do you determine if you or someone you know has anorexia? Your doctor or nurse will ask you questions about your symptoms and medical history. It may be difficult to talk to a doctor or a nurse about secret eating or exercise behaviors. However, your doctor and nurse wants to help you. Your doctor will do a physical exam and other tests, such as blood tests and a urine test, to determine and rule out health problems that may cause severe weight loss. Your doctor may also do other tests, such as kidney function tests, bone density tests, an electrocardiogram or ECG or EKG to see how severe weight loss has affected your health. So, how is anorexia treated? Treatment plans may include one or more of the following. Nutrition therapy. This is where doctors, nurses, and counselors will help you eat healthy to reach and maintain a healthy weight. Some girls or women may need to be hospitalized or participate in a residential treatment program to make sure they eat enough to recover. This means you will basically live temporarily at a medical facility. Hospitalization may also be required to monitor any health problems in people with anorexia. Reaching a healthy weight is a key part of the recovery progress so that your body's biology, including thoughts and feelings in your brain, work correctly. Another treatment method is psychotherapy, sometimes called talk therapy. Psychotherapy is counseling to help you change any harmful thoughts or behaviors. This therapy may focus on the importance of talking about your feelings and how they affect what you do. For girls with anorexia, counseling may involve the whole family. Another treatment method or plan might include a support group, which can be helpful for some people with anorexia when added to other treatment. In support groups, females and sometimes their families meet and share their stories. Another treatment method might be medicine. Studies suggest that medicines like antidepressants can help some girls and women with anorexia by improving the depression and anxiety symptoms that often come along with anorexia. Okay, so how does anorexia affect pregnancy? Anorexia can cause problems getting pregnant and also develop problems during pregnancy. Extreme weight loss can cause missed menstrual periods because you may not ovulate or release an egg from the ovary. When you do not weigh enough to ovulate, it is difficult to get pregnant. However, if you do not want to have children right now and you have sex, you should use birth control. Anorexia can also cause problems during pregnancy. Anorexia raises your risk for a miscarriage, premature birth, also called preterm birth, or childbirth before 37 weeks of pregnancy. It can also cause a delivery by C-section, which is cesarean section. Having a low birth weight baby, less than 5 pounds 8 ounces at birth. So they determine a low weight baby to be less than 5 pounds 8 ounces. Anorexia can also cause you to have depression after the child is born, which they call postpartum depression. Questions you may ask. If you had an eating disorder in the past, can you still get pregnant? Yes, women who have recovered from anorexia and are at a healthy weight and have normal menstrual cycles have a better chance of getting pregnant and having a safe and healthy pregnancy. Tell your doctor if you had an eating disorder in the past and you are trying to currently get pregnant. If you take medicine to treat anorexia, can you breastfeed your baby? Maybe. Some medicines used to treat anorexia can pass through breast milk. Certain antidepressants can also be used safely during breastfeeding. Please talk to your doctor to find out which medicine works best for you. Okay, so that ends what anorexia nervosa is, symptoms of anorexia, possible treatment methods of anorexia. So if you like my content, leave a comment below, like my video, and subscribe. The link is in the description below. Also in the description, I will have links to other medical stuff that if you are interested, you can click on them, you can buy, or just read along. So until our next time, this is Women's Health Issues, and we have just covered the topic anorexia nervosa. Next video will be another health issue that affects women only, or mostly women. So hit that subscribe button, hit the bell notification so that you will be alerted every time we release a video. So until the next time, see y'all.